Hi everyone, this is Erika Bennett with South Georgia Medical Center, and I'm here today with our President and Chief Executive Officer, Mr. Ronnie Dean. Mr. Dean, thank you for joining us today.
Thank you, Erika.
And we are here in our new location for SGMC Family Medicine in Valdosta in North Lowndes. The new location is over behind Cass Birch and AmeriMed Pharmacy and kind of close to Smoke and Pig, if you're familiar with that area. But we're really excited to have these physicians operating in this practice here. Do you want to tell us a little bit about it?
I do. No more excited than they are. These physicians have been practicing, I think, in an area called Greystone. They're now here on Kingsway, close to the Smith Northview Hospital campus. Dr. Kyle Adams, Dr. Guadiana, Dr. Dennis Thomas, Dr. Cliff Thomas. They've been in practice for a long time. Putting them together in one modern facility with plenty of space to do the things they're especially trained to do is very exciting for us and for them. They began seeing patients here on Monday, November 2nd. Those patients will enjoy nice accommodations, modern facilities, as you can see, and it's our investment in our doctors so they can be remarkable for the patients that they see that come. So we're really excited about this, and I think the public will very much enjoy what they have to offer here.
Yes, so this new location will enhance patient access to care because we'll have more patient rooms, so they'll be able to see more patients. So definitely very good for the community and a great location. So if you don't have a primary care physician and you're looking one, certainly you can go to our website to find out more information about how to book your appointment with one of these fine physicians.
Exactly.
We also have a lot of new programs that are going on that are happening. Can you tell us?
We do. Let's start with the physicians that are coming or have recently arrived. The viewing public has heard me talk about the idea that we need more and more physicians, and they're arriving. We're very pleased to have Dr. Matthew Brown, infectious disease, that we've introduced, Dr. Kim Mackey, neurosurgeon, that we've introduced, and there are a number of others. The most recent addition is Dr. Dirkshine, is an interventional cardiologist, and he has joined our cardiology clinic at SGMC. He is an interventional cardiologist. He provides medical cardiology as well as all the catheter-based procedures that one might need should you need a coronary intervention. He is extremely well trained, and we're very excited about that. And we're equally excited about a couple of other physicians, specialists that will be joining us. I want to mention three in particular. Dr. Yerkeson is a new general surgeon that will be joining our general surgery practice in January, as well as Dr. Shoptaw, which is cardiothoracic surgery. Now, he'll be coming later in the year, next year, but Dr. David Hardy, a fellowship-trained vascular surgeon, will be joining us from Cleveland, Ohio. He'll be relocating his family here. He is at the Cleveland Clinic. He is a Cleveland Clinic vascular surgeon. For those of you interested in knowing more about him, you can find him online at the Cleveland Clinic website. But Dr. David Hardy is eminently qualified to be a vascular surgeon and has done remarkable work up there. And for him to relocate from the Cleveland Clinic to Valdosta, Lowndes County to serve this region is extremely exciting. So we're looking forward to his arrival. And there are many more that are in the pipeline because this community needs access to specialty care so folks don't have to travel. And the goal is to create unequaled access by having great physicians, great programs, and great facilities like the one we're in now.
Absolutely. I think we welcomed 17 new physicians over this past year, so that's pretty impressive, and I look forward to seeing where we go now that our new year has started.
You know, we have, and physicians, like nurses, are the lifeblood of any health delivery system. And the fact of the matter is, patients don't come to buildings, they come to see their physicians and their nurses. So having those physicians help us develop programs. You mentioned programs earlier. You know, there are so many things that we're developing right now. A new comprehensive wound care center will be coming online very, very soon. We are expanding our offerings in the birthplace at SGMC. That's our labor and delivery suites that have been around a long time. Very excited to work with our neonatologists, our pediatricians, and our obstetrics community. Obstetricians that reside here in this community deliver patients deliver babies and take care of patients at our facilities. And to enhance that care delivery experience, 2 really interesting services are about to come on. And I hope the community enjoys it. Everyone seems to think that it will really enhance the birthing experience in a lot of ways. The number one program I'd like to tell you about is called Angel Eye. Angel Eye is a video application that will allow families in remote areas to view the newborn after delivery and the mom and experience the thrill of childbirth and delivery here at South Georgia Medical Center. It's a very special time when one gives birth, and to be able to share that in a very private and discreet way with loved ones that may be far away. I think about our Moody Airmen, Moody Air Force Base, and the airmen that are out there, and sometimes they're away from a delivering spouse. And you think about them being able to access and be a part of that and see the newborn and check in with the mom through a discreet, secure video application. So look out for Angel Eye. It's very special program that we're going to have here, and not many people have it as far as I know, around the nation, but we'll have it here for the SGMC birthplace. The second program that relates to women and the childbirth experience has to do with hospitalists. Now, we know what a hospitalist is from an adult care standpoint, but we really haven't ever talked about a hospitalist for an obstetrics standpoint. Our obstetrics staff, our OBGYNs, do a great job, and moms come into our facility all times of the day and night, and sometimes their obstetrician may not be available, and they come in and they may need to be in quickly, and things are moving rapidly. That child may be coming and they may be having difficulty, and so this obstetrics hospitalist program is about having an obstetrician inside the building 24/7. And then when moms need to come be checked, sometimes there's something going on, and you know what I'm talking about, Erika, and you're a little worried, and they say go to the emergency room to get checked, and you're checked by one of our obstetrics nurses. A medical screening, if you will, occurs. Well, these obstetricians will be there to provide those medical screenings in what's called an obstetrics emergency department. Those programs are will be online somewhere in the February timeline. Our goal is to serve the needs of the women's health care in this region by adding programs and services like this. And the delivering moms, look for an experience that is, satisfying and safe. Mm-hmm. And so these programs not only enhance the experience, but they also create a safety net for our moms. We have the only level 2 NICU in the region. We have an abundance of obstetricians that deliver here. We deliver more babies than anyone, so we aim to be prepared for those times when moms need an obstetrician quickly, and that's the obstetrics hospitalist and emergency department program. Very excited about that, and we'll be talking more about that in detail as it develops, Erika.
Yes, very exciting things to hear, especially as a mom of 2 who has delivered at South Georgia Medical Center. I love to see our leadership investing in this type of equipment and people to take care of the moms. I know for the Angel Eye, we mentioned just regular labor and delivery, but I imagine it could be especially beneficial for NICU babies as well. When parents have to leave their children, that they would be able to log in anytime and see their baby real time.
Yeah,
it's very beneficial.
Right. That's right. The mom gives permission to whomever she wants to log in and look in. Mm-hmm. And remember, we're still battling COVID, right, and we're not letting as many family members in. So this will only enhance that visitation experience and do it in a virtual way to enhance the experience for the delivering moms in the region. We're very excited about it, Erika.
Very good. Very exciting times here at South Georgia Medical Center. Very proud to be a part of it. So anything else you wanted to share today?
Well, I'm wearing pink again today. Remember, men wear pink because they care about the women in their lives. And I just want to remind all the women out there that are eligible for a mammogram, go get your mammograms. They're very easy to schedule. Have it. We save lives when we do screening mammograms. And then the last thing I would remind everyone is we are entering into the flu season. Please get your flu shot if you haven't. If you don't know where to get it or you need somewhere to get it, call us and we'll direct you and we'll help you with that. I believe the community is responding to the call to be very safe as we go into this uncertain time period. We don't have a lot of COVID-19 patient admissions right now, thank goodness, and I really believe it's because the community down here has done what's required, and you never can tell. We may be turning a quarter, although it seems to be on the increase in other areas of the nation and maybe the world. But we're ready for whatever comes. Right now, I think the best thing we can do is more or less, just prepare for the worst and expect the best. And I think flu shots help us be prepared.
Thank you, Mr. Dean. And I want to thank everyone for listening and tuning in today. Again, we're at SGMC Family Medicine. It's in Kingsway now, and they will start seeing patients on Monday. For more information about any of our physicians, primary care, or any of the specialty care services that you heard about today, please just check out our website at sgmc.org. Thank you.
Thank you.